Hello everyone. Today we will be discussing about the most important concern of an injector or a patient while injecting near this area, the eye area. So most of us thinks that if we are going to inject botox, fillers or any injectables, then there is a chance of blindness or the vision loss. So let's talk about how blindness occur, what exactly is the reason behind the blindness, right? So blindness happens because of the two nerve and two vessels. So cranial nerve number 2, that is optic nerve, and oculomotor cranial nerve number 3, both are responsible for the vision loss or the blindness. So let's talk about the course of optic nerve. Optic nerve enters into the skull via optic foramen, then it enters into the optic canal and then reaches to the orbit, right? And which is present in the middle cranial fossa. It's right here inside the skull. Okay, and then it reaches to the orbit. If there is a damage or to that nerve, then it might be possible blindness can occur. And this nerve is accompanied via ophthalmic artery, which is a branch of internal carotid artery. If somehow this ophthalmic artery is occluded, then it also leads to impaired vision or compromised vision or sometimes blindness. And another cranial nerve which is involved is cranial nerve number 3, that is oculomotor nerve. So oculomotor nerve exit the skull via supraorbital fissure, and from there it enters into the orbit and supply the orbit. If anyhow damage to that nerve happened, then it can leads to blindness. And it is all these things are inside, not the outside of the face. Then another artery, one is optic nerve, another is of the oculomotor nerve, third is ophthalmic artery, and fourth is retinal artery, which is also present inside. The reason can be retinal artery, which if there is a damage to the retinal artery, then it can lead to blindness or the compromised vision. But anyhow, we are not touching all these four things. The only concern is we have a foramen here. Right here is infraorbital foramen, and here we have supraorbital foramen. And from the infraorbital foramen we have nerves and vessels, infraorbital nerves, which have sensory nerve supply, which will give supply to this area, lower lid area. And from the upper supraorbital foramen we have supraorbital nerves, vessels and supratrochlear vessels also, which will supply the upper eyelids, which will give sensory nerve supply to this area, upper lid area, the forehead area and the scalp area. If we are going to inject here or somehow we injected properly we didn't inject it, तो टॉसिस हो जाता है. टॉसिस मीन्स कि हमारी आई ड्रूपिंग हो जाती है. दैट्स इट. It is not going to damage your eye in that way कि blindness हो जाए, right? So we will be injecting, all the injectors in my training are injecting in a very special manner with the micro cannulas. We don't use in this area, we don't use needle directly. We use micro cannula to prevent any damage to this area. And that's it. There is no correlation of botox, fillers or any injectable with the blindness. So first you should know what is the cause of blindness, then only you can tell कि blindness हो सकती है कि नहीं हो सकती. Thank you.